Okay, my name is Molly, and today I'm going to be talking about fetal alcohol syndrome, which is part of a broader group of disorders called fetal alcohol spectrum disorders, or FASDs. Fetal alcohol syndrome is caused by alcohol exposure before birth. It affects how the brain and body develop, and it can lead to lifelong challenges. It's also considered the most severe form of FASD. Even though it's completely preventable, the effects are permanent. This is important because it shows how early development can be affected before a child is even born. So the cause is alcohol use during pregnancy. Alcohol passes through the placenta and directly affects the baby's development, especially the brain. Because of this, experts say that there is no safe amount of alcohol during pregnancy. This highlights how even small exposures can have serious impacts. So in the United States, FASDs are estimated to affect about 1 to 5 out of every 100 children. Both boys and girls are affected equally, and symptoms usually become more noticeable during early childhood, like in preschool or elementary school. This can sometimes make it harder to recognize right away. Okay, so for symptoms, they can vary a lot from child to child, but they generally affect physical development, learning and thinking, and behavioral and social skills. This wide range is part of what makes FASD more complex to identify and support. Some physical signs include smaller height or weight, a smaller head size, slower growth, and certain facial differences. These signs can sometimes be noticeable early on, but not always in every child. Children with FAS often have trouble paying attention, may experience learning delays, and can struggle with memory and problem solving. This can make school more challenging and may require additional support in the classrooms. They may also act impulsively, have difficulty following directions, struggling with routines or changes, and have challenges with social interactions. These behaviors can sometimes be misunderstood if people don't know the underlying cause. There is no single test for FAS. Diagnosis usually involves a team of professionals like pediatricians, psychologists, and speech or occupational therapists. This team approach helps give a more complete understanding of the child's development. So, to make a diagnosis, professionals look at things like medical and prenatal history, growth patterns, physical features, and developmental or learning evaluations. Looking at multiple areas helps ensure a more accurate diagnosis. Because FAS affects so many areas of development, early support is really important. Structure, consistency, and early intervention can help improve long-term outcomes. This can make a really big difference in a child's ability to succeed both in school and also socially. So are different types of interventions that can help support children with FAS, but I'm going to focus on two. So the first one is parent-child interaction therapy and self-regulation training. Both of these target important areas of development. Parent-child interaction therapy, or PCIT, focuses on improving the relationship between parents and children while also reducing behavioral problems. Parents are coached in real time so they can learn effective ways to respond to their child. This is especially helpful because it gives parents tools that they can use in everyday situations. This approach can improve behavior and strengthen relationships, but it does require time and access to trained therapists. The second intervention is self-regulation training. This focuses on helping children improve attention, impulse control, and emotional regulation, which are key challenges in FAS. These are skills that are really important for success in school and social situations. It can be used in both home and school settings, but progress can take time and requires consistency. So for the three of my favorite resources that I found, I chose a research article by Cook and colleagues because it provides a strong overview of FASD diagnosis. I also chose a book by Clark because it focuses on practical strategies for families, which makes it more relatable. And then for my podcast, I chose one from the National Institute on Alcohol Abuse and Alcoholism because it explains FASD in a way that's easy to understand. And then lastly, if someone wanted to learn more or get support locally, there's 2 resources that I found in northern Colorado that provide behavioral health services and support for both children and families. These can be helpful for both information and also real services.